The mobile surgical unit will make a huge difference at Moree Hospital. Previously, when we've had renovations done at the hospital, we have had to actually shut down our emergency and our elective surgery. So it really makes a difference with our waiting list targets. We still have to meet all the targets that New South Wales Health actually give us. And overall, it's just going to make the perioperative nurse's life much better, because we're going to be able to still provide a service to the community. We have Australian standards that govern how we actually practice as perioperative nurses, and also how we have ventilation systems in the health service, how we actually have filtration systems, how we sterilise things. And this mobile health unit meets every standard. It actually goes over and above the standard. To have like theatre lights that are state of the art, you know, you can see to do your procedures better. The benefits to the community, we just can't measure that, because to be without an operating room service at a hospital for 18 to 20 weeks just can't happen. Like, it could mean a person could die. This unit will save lives.
The theatre refurbishment has been planning stages for some time. We needed a solution to relocate the theatres. The engineer from the maintenance department and the nurse unit manager from theatre visited a similar setup in Moree, and it looked wonderful for us as a solution to relocating the theatres.
We are in a remote area of Australia, as you know. Mount Isa is considered in the outback. And if we didn't have this mobile unit ready for us to use when the operating theatres were under renovation, we would have to essentially put a stop to our surgical services here. And I must say I was very impressed with the setup. From what I could see from the members of my team, they're very, very happy with the orientation that was given. I mean, we were made very well aware of all the facilities that are available within this setup. And I must say, everything looks very spick and span, and I'm particularly impressed with the aircon. In Mount Isa, air conditioning is definitely very important.
To maintain the surgical services here within the health service is really critical. Otherwise, we've got people travelling outside the health service. There'd be no emergency surgery available. So it maintains the health services for the people of Queensland in the northwest.
The mobile health unit has been a success for Mount Isa's community and for the staff while we've been here. The unit's been running successfully for at least 5 weeks, and we haven't had to alter any of our services while it's been in place.
Since about the 1st of April, we've done approximately 190 cases between the two mobile units. So general surgery with laparoscopy, we've done some endoscopy, we've done ophthalmology for eyes, we've done dental, and we've done C-sections. So we've had some babies delivered in the mobile units. So the midwives have also come down and set up their panda warmers in the units as well.
I think we had a great amount of positive aspects because they were really clean, neat and tidy. They were really compact. They had great amount of storage space, and then the recovery was also included in the unit. So it was pretty easy to get a patient into the theatre and then do the procedure and take them out during after hours. And you're doing an emergency case, you don't need to run out of the mobile health unit to get stuff. You could actually have everything in the mobile health unit because they've got heaps of storage space.
The mobile health unit was received very well by the staff and the community and worked exceptionally well during this process of theatre refurbishment.
This mobile health unit has really met our expectations. I don't think anyone else could do any better for us.
We have one operating theatre which needed refurbishment, and we found out late last year that the refurbishment was going to take 3 months, during which time we wouldn't have an operating theatre. There's a fair bit of waiting list pressure, and our maternity unit has a 24/7 caesarean section coverage, and we were very concerned that if we didn't have an operating theatre in the area, our patients would suffer. The theatre was very well organised with a place for everything. There was a massive benefit of having the mobile theatre. It meant that we could continue to run our obstetric service as normal, so women could come into the hospital, to have their babies in the knowledge that if they required an emergency caesarean, they didn't have to be transferred. There was also an enormous benefit for the people that were waiting for surgery not to have to wait another 3 months for their elective surgery. A lot of people would have suffered quite a bit had we not had that theatre for the 3 months that our main theatres were out of action.